TB. Tuberculosis, TB, is an infectious disease caused by the bacterium Mycobacterium tuberculosis. The disease has a long history, dating back thousands of years. It has had a profound impact on human populations throughout history. Historical evidence of TB. There is evidence of tuberculosis in ancient Egyptian mummies, indicating that the disease has been present for at least 4,000 years. The disease was also widespread in ancient Greece and Rome, where it was known as phthisis and was considered incurable. In the Middle Ages, tuberculosis was known as the consumption due to the way it appeared to consume the body. TB was a leading cause of death during this time, and its effects were often romanticized in literature and art. TB in the modern era. During the Industrial Revolution in the 18th and 19th centuries, TB became a major public health issue in Europe and North America. The crowded and unsanitary conditions of urban areas provided the perfect breeding ground for the disease, and it spread rapidly. In the early 20th century, the development of the tuberculin skin test took place. The discovery of streptomycin, the first effective antibiotic against TB, marked a turning point in the fight against the disease. Public health campaigns were launched to promote hygiene and prevent the spread of TB, and sanatoriums were established to isolate and treat those infected. Despite these efforts, TB remained a significant public health threat throughout much of the 20th century. In the 1980s and 1990s, the emergence of drug-resistant strains of TB, particularly in developing countries, posed a new challenge to the global fight against the disease. Recent developments. In recent years, there have been significant advances in the diagnosis and treatment of TB. New diagnostic tools, such as the Gene Expert test, can quickly and accurately identify TB and drug-resistant strains of the disease. And new drugs, such as bedaquiline and delamain, offer hope for those with drug-resistant TB. The World Health Organization has set a goal of ending the global TB epidemic by 2030, and efforts are underway to improve TB prevention, diagnosis, and treatment worldwide. However, significant challenges remain, particularly in developing countries where access to healthcare and adequate resources are limited. What is tuberculosis? Tuberculosis, TB, is a bacterial infection caused by the bacterium Mycobacterium tuberculosis. It primarily affects the lungs but can also infect other parts of the body such as the kidneys, spine, and brain. TB is spread through the air when an infected person coughs or sneezes, releasing bacteria-containing droplets into the air that can be inhaled by others. Symptoms of TB can include a persistent cough, chest pain, fever, night sweats, and weight loss. If left untreated, TB can be a serious and potentially fatal disease. However, with proper treatment, which typically involves a combination of antibiotics taken over several months, most people with TB can be cured. TB is a global public health problem, with an estimated 10 million people worldwide becoming sick with the disease each year. Poverty. TB disproportionately affects people in low and middle income countries, where factors such as poverty, malnutrition, and HIV co-infection contribute to the spread of the disease. However, TB is also a concern in wealthier countries, particularly among people who have weakened immune systems, such as those with HIV, or who live in crowded or institutional settings. How common is tuberculosis? Tuberculosis, TB, is a significant global public health problem. According to the World Health Organization, WHO, an estimated 10 million people worldwide became sick with TB in 2019. TB is more common in low and middle income countries, where poverty, malnutrition, and overcrowding can contribute to the spread of the disease. In 2019, the countries with the highest incidence of TB were India, followed by Indonesia, China, the Philippines, Pakistan, Nigeria, Bangladesh, South Africa, and the Democratic Republic of the Congo. However, TB is also a concern in wealthier countries, particularly among people with weakened immune systems, such as those with HIV, and those living in crowded or institutional settings. In the United States, there were 8,917 reported cases of TB in 2019, a rate of 2.7 cases per 100,000 people. It's worth noting that these numbers likely underestimate the true burden of TB, as many cases go undiagnosed and unreported. Additionally, the emergence of drug-resistant strains of TB poses a particular challenge to global efforts to control and eliminate the disease. Are there different kinds of tuberculosis? Yes, there are different kinds of tuberculosis, TB, which can be classified based on various factors, such as the site of infection, the severity of the disease, and drug resistance. Here are some examples. Pulmonary TB. This is the most common form of TB and affects the lungs. It can cause symptoms such as coughing, chest pain, and difficulty breathing. Extrapulmonary TB. This type of TB occurs outside of the lungs and can affect other parts of the body, such as the lymph nodes, bones, and kidneys. The symptoms depend on the location of the infection. Latent TB infection. This occurs when a person is infected with the TB bacteria, but does not have active TB disease. People with latent TB infection do not have symptoms and cannot spread the disease to others, but they are at risk of developing active TB later in life. Drug-resistant TB. This occurs when the TB bacteria become resistant to one or more of the antibiotics used to treat the disease. Drug-resistant TB can be much harder to treat and may require longer and more complex treatment regimens. TB/HIV co-infection. People with HIV are at increased risk of developing TB, and TB can also accelerate the progression of HIV. TB/HIV co-infection can be more difficult to diagnose and treat than either disease alone. Miliary TB. This occurs when the TB bacteria spread throughout the body and cause widespread infection. Miliary TB can be life-threatening and requires prompt treatment. Miliary tuberculosis. Miliary tuberculosis, TB, is a rare form of the disease that occurs when the TB bacteria spread throughout the body, usually through the bloodstream. In miliary TB, small nodules or lesions develop in various organs, resembling millet seeds in appearance, which gives the condition its name. Miliary TB can affect many organs in the body, including the lungs, liver, spleen, kidneys, bone marrow, and brain. The symptoms of miliary TB depend on the organs affected and can be nonspecific, including fever, weight loss, night sweats, fatigue, and cough. If miliary TB is not diagnosed and treated promptly, it can cause serious complications, such as organ failure, sepsis, and meningitis. In some cases, it can even be life-threatening. Sterile pyuria. Sterile pyuria is a condition where there are high levels of white blood cells in the urine, but no bacteria or other microorganisms are present. Miliary TB can cause sterile pyuria due to inflammation of the genitourinary system. Other conditions that can cause sterile pyuria include kidney stones, bladder cancer, and interstitial cystitis. Pott's disease. Pott's disease, also known as spinal tuberculosis or tuberculosis spondylitis, is a rare form of TB that affects the spine. It can cause back pain, spinal deformity, and neurological symptoms such as numbness or weakness. Pott's disease can be caused by the spread of TB bacteria from other parts of the body, such as the lungs, through the bloodstream. Addison's disease. Addison's disease is a condition where the adrenal glands do not produce enough hormones, including cortisol and aldosterone. Miliary TB can cause adrenal gland destruction, leading to Addison's disease. Symptoms of Addison's disease can include fatigue, weight loss, low blood pressure, and darkening of the skin. Hepatitis. Hepatitis is a liver infection that can be caused by a variety of factors, including viral infections, alcohol abuse, and certain medications. Miliary TB can cause hepatitis due to inflammation of the liver. Symptoms of hepatitis can include jaundice, yellowing of the skin and eyes, fatigue, nausea, and abdominal pain. Lymphadenitis. Lymphadenitis is a condition where the lymph nodes become inflamed and swollen. In miliary TB, lymphadenitis can occur in the neck, causing the condition known as scrofula or TB lymphadenitis. Symptoms can include a firm, painless swelling in the neck, as well as fever, night sweats, and weight loss. The diagnosis of miliary TB can be challenging, as the symptoms are similar to those of other conditions, and the lesions can be small and difficult to detect on imaging tests. Diagnosis may involve a combination of blood tests, imaging tests, such as chest X-rays and CT scans, and culture tests to identify the presence of TB bacteria. Treatment of miliary TB involves a combination of antibiotics for at least 6 to 9 months, as with other forms of TB. However, the treatment may need to be modified depending on the severity of the disease and the organs affected. In some cases, surgery may be required to remove infected tissue or relieve pressure on affected organs. These are just a few examples of the different types of TB. The specific type of TB a person has can affect the symptoms they experience and the treatment they require. What causes tuberculosis? Tuberculosis, TB, is caused by a bacterium called Mycobacterium tuberculosis. This bacterium spreads through the air when an infected person coughs, sneezes, or talks, and another person inhales the bacteria. Spread. TB is not spread through shaking hands, sharing food or drink, or kissing. Once the TB bacteria enter the lungs, they can cause an infection that may or may not develop into active disease. The immune system of a healthy person can usually fight off the TB bacteria, and the infection remains dormant or latent. However, if the immune system is weakened, such as in people with HIV/AIDS or those undergoing chemotherapy, the bacteria can become active and cause tuberculosis disease. Other factors that increase the risk of TB include malnutrition, smoking, diabetes, and certain medications, such as corticosteroids and immunosuppressants. TB can also be more common in overcrowded or poorly ventilated living conditions, and in people who work or live with individuals who have active TB disease. How is tuberculosis spread? Tuberculosis, TB, is primarily spread through the air when an infected person coughs, sneezes, or talks, and another person inhales the bacteria. TB is not spread through casual contact, such as shaking hands, sharing food or drink, or kissing. The risk of TB transmission is higher in crowded or poorly ventilated spaces, such as prisons, homeless shelters, and hospitals. It is also more common in people with weakened immune systems, such as those with HIV/AIDS, people undergoing chemotherapy or organ transplantation, and elderly individuals. It is important to note that not everyone who is exposed to TB bacteria will develop active TB disease. In fact, most people who are infected with TB do not develop active disease and remain asymptomatic, which is called latent TB infection. However, people with latent TB infection are at risk of developing active TB disease in the future, particularly if their immune system becomes weakened. TB is more common in certain parts of the world, particularly in low and middle-income countries. With inadequate public health infrastructure, and where there are high rates of poverty, malnutrition, and HIV/AIDS. What are the signs and symptoms of tuberculosis? The signs and symptoms of tuberculosis, TB, depend on whether the infection is active or latent. Most people who are infected with TB bacteria do not have symptoms and have a latent TB infection, which means the bacteria are present in the body but are not causing any symptoms or spreading the disease to others. However, in some cases, TB bacteria can become active and cause symptoms. The most common symptoms of active TB disease include persistent cough that lasts more than 3 weeks, coughing up blood or sputum, phlegm or mucus, from deep inside the lungs, chest pain or discomfort, fatigue or weakness, fever, chills, and night sweats, loss of appetite and weight loss, shortness of breath or difficulty breathing. Other less common symptoms of active TB disease can include joint pain, swollen lymph nodes, and abdominal pain. Other parts. TB can also affect other parts of the body, such as the kidneys, spine, or brain, leading to additional symptoms depending on the location of the infection. It is important to note that some people with active TB disease may not experience any symptoms, or may have mild symptoms that develop slowly over time, making it difficult to diagnose. If you are experiencing any of these symptoms, or have been in contact with someone who has TB, it is important to see a healthcare provider for testing and treatment. What kinds of tests are used to diagnose tuberculosis? Several tests can be used to diagnose tuberculosis, TB, depending on the circumstances and the individual's symptoms. These tests include tuberculin skin test, TST, also known as a Mantoux test. This involves injecting a small amount of tuberculin protein into the skin of the forearm and observing the reaction after 48 to 72 hours. A positive result indicates that a person has been infected with TB bacteria, but does not necessarily mean they have active TB disease. Interferon gamma release assays, IGRAs. These blood tests measure the release of interferon gamma by T cells in response to TB antigens. They are more specific than the TST and are less likely to be affected by prior BCG vaccination. Chest X-ray. A chest X-ray can detect changes in the lungs that may be indicative of TB disease, such as cavities or nodules. Sputum culture. This involves collecting a sample of sputum, phlegm or mucus, and culturing it in a laboratory to see if TB bacteria are present. Gene Expert NTB/REEF assay. This is a newer test that can detect TB bacteria and test for resistance to rifampicin, a first-line TB drug, within hours. It uses a machine to detect the presence of TB DNA in a sputum sample. If a person tests positive for TB, additional tests may be done to determine if the infection is active or latent, and to assess the extent of the disease. This may include a chest CT scan, bronchoscopy, or biopsy of affected tissues. It is important to consult with a healthcare provider to determine the appropriate testing and treatment plan. How is tuberculosis treated? Tuberculosis, TB, is treated with a combination of antibiotics that are taken for at least 6 months. The specific antibiotics and duration of treatment depend on the type of TB, the person's age, weight, medical history, and other factors. The most common antibiotics used to treat TB are isoniazid, rifampicin, pyrazinamide, and ethambutol. These drugs work by killing the bacteria that cause TB or preventing them from multiplying. It is important to take all medications as prescribed and for the entire length of time recommended, even if symptoms improve or disappear. In addition to medication, people with active TB disease should also take measures to prevent the spread of infection to others, such as staying home and avoiding close contact with others until they are no longer contagious. Good hygiene practices, such as covering the mouth and nose when coughing or sneezing and washing hands frequently, can also help prevent the spread of TB. People with latent TB infection may also be prescribed medication to prevent the development of active TB disease in the future. This is called TB preventive therapy and usually involves taking a single medication, such as isoniazid, for at least 6 months. It is important for people with TB to work closely with their healthcare provider and follow the treatment plan as directed. Failure to complete the full course of medication or skipping doses can lead to drug-resistant TB, which is more difficult and expensive to treat. Rifapentine. Rifapentine is a rifamycin antibiotic drug used to treat tuberculosis, TB. It was first approved by the United States Food and Drug Administration, FDA, in 1998 and was initially marketed by Sanofi Aventis under the brand name Prifton. In 2019, the FDA approved the use of rifapentine in combination with isoniazid for the treatment of latent TB infection, a form of TB in which the bacteria remain dormant in the body but can become active later on. Since its introduction, rifapentine has been a valuable addition to TB treatment regimens due to its long half-life and ability to kill TB bacteria quickly. Its use has helped to shorten the duration of treatment for TB and improve treatment outcomes, particularly in patients with drug-susceptible TB. Rifapentine is a type of antibiotic medication that is used to treat and prevent tuberculosis, TB, infection. It is a long-acting rifamycin antibiotic that is similar to rifampicin, another commonly used TB medication. Rifapentine is used in combination with other TB medications, such as isoniazid, pyrazinamide, and ethambutol, to form a complete treatment regimen for TB. Rifapentine works by inhibiting bacterial RNA polymerase, which is essential for the bacteria to make proteins and reproduce. By inhibiting this process, the bacteria are unable to replicate and are eventually killed off by the body's immune system. Rifapentine is usually taken once a week in combination with other TB medications for a total of 3 months to treat active TB disease. It can also be used as part of a 12-week regimen for latent TB infection. Rifapentine is often preferred over rifampicin due to its longer half-life, which allows for less frequent dosing and improved patient adherence to the medication regimen. Like all medications, rifapentine can cause side effects. Common side effects may include upset stomach, nausea, vomiting, and rash. More serious side effects are rare, but can include liver problems, low blood cell counts, and allergic reactions. It is important to discuss any potential side effects with a healthcare provider before starting rifapentine or any other medication. Bedaquiline. This medication must be used with other medications to treat active multidrug-resistant tuberculosis, TB, of the lungs in people with limited treatment options. Bedaquiline belongs to a class of drugs known as antibiotics. It works by stopping the growth of the bacteria that causes TB. This antibiotic treats only bacterial infections. It will not work for viral infections, such as common cold, flu. Using any antibiotic when it is not needed can cause it to not work for future infections. Delamanid is an anti-tuberculosis agent derived from the nitrodihydroimidazooxazole class of compounds that inhibits mycolic acid synthesis of bacterial cell wall. It is used in the treatment of multidrug-resistant and extensively drug-resistant tuberculosis, TB, in a combination regimen. Emergence of multidrug-resistant and extensively drug-resistant tuberculosis creates clinical challenges for patients, as the disease is associated with a higher mortality rate and insufficient therapeutic response to standardized anti-tuberculosis treatments as isoniazid and rifampicin. Multidrug-resistant tuberculosis may also require more than 2 years of chemotherapy and second-line therapies with narrow therapeutic index. What are the complications/side effects of treatment? While treatment for tuberculosis, TB, is effective and necessary, it can also have side effects and complications. Some of the most common complications and side effects of TB treatment include gastrointestinal problems. Antibiotics used to treat TB can cause upset stomach, nausea, vomiting, and diarrhea. These symptoms can usually be managed with over-the-counter medications and changes in diet. Liver damage. Certain TB medications can cause liver damage, especially in people with pre-existing liver conditions or those who consume alcohol regularly. Monitoring liver function with blood tests is usually recommended during TB treatment. Skin rashes. Some people may experience skin rashes or itching as a result of TB medication. These symptoms can usually be managed with over-the-counter creams or lotions. Vision problems. Rarely, TB medication can cause visual changes or even vision loss. It is important to report any changes in vision to a healthcare provider immediately. Hearing loss. Some TB medications, such as streptomycin, can cause hearing loss. Regular hearing tests may be recommended during treatment. Drug interactions. TB medications can interact with other medications, including birth control pills and HIV medications. It is important to tell a healthcare provider about all medications and supplements being taken. Drug resistance. Failure to complete the full course of TB medication can lead to drug-resistant TB, which is more difficult to treat and may require more aggressive treatment. It is important to discuss any potential side effects and complications with a healthcare provider before starting TB treatment. Close monitoring and follow-up care can help minimize the risk of complications and ensure successful treatment of TB. What are the complications of tuberculosis infection? Tuberculosis, TB, infection can lead to a number of complications, especially if left untreated. Some of the most common complications of TB infection include active tuberculosis. If TB infection becomes active, it can cause a range of symptoms, such as coughing, fever, night sweats, and weight loss. Active TB can also spread to other parts of the body and cause complications in other organs, such as the lungs, brain, and kidneys. Drug-resistant tuberculosis. If TB infection is not treated properly, it can become drug-resistant. Drug-resistant TB is much harder to treat and can require more aggressive treatment methods, such as multiple antibiotics or longer treatment duration. Spread of TB infection. Active TB infection can be contagious and spread to other people through coughing, sneezing, or even talking. This can lead to the spread of TB in communities or populations. Complications in other organs. TB infection can spread to other organs in the body, such as the brain, kidneys, bones, and joints. This can cause a range of complications, such as meningitis, kidney failure, spinal cord compression, and joint damage. Death. In severe cases, untreated TB infection can be fatal. This is more common in people with weakened immune systems, such as those with HIV/AIDS or other chronic illnesses. It is important to seek medical attention if you suspect you have been exposed to TB or are experiencing symptoms of TB infection. Early detection and treatment can help prevent complications and the spread of TB to others. Can tuberculosis be cured? Yes, tuberculosis, TB, can be cured with appropriate treatment. The treatment for TB typically involves a combination of antibiotics, taken for at least 6 months. This can be longer for some forms of TB, such as drug-resistant TB. The antibiotics kill the bacteria that cause TB and stop the infection from spreading. It is important to complete the full course of treatment as prescribed, even if symptoms improve or go away before the treatment is finished. This helps to ensure that all of the bacteria are killed and helps prevent drug resistance. With appropriate and timely treatment, most people with TB can be cured and can return to their normal activities. However, it is important to continue to follow up with healthcare providers after treatment to ensure that TB has been fully cured and to monitor for any possible complications or recurrences of the infection. What can you do to prevent spreading tuberculosis? To prevent the spread of tuberculosis, TB, it is important to follow some basic precautions. Take all medication as prescribed. If you have been diagnosed with TB infection or disease, it is important to take all medications as prescribed by your healthcare provider. This can help to prevent the spread of TB and prevent drug resistance. Cover your mouth when coughing or sneezing. Cover your mouth and nose with a tissue or cloth when coughing or sneezing, and dispose of the tissue properly. This can help to prevent the spread of TB bacteria through the air. Wear a mask. If you have TB disease, wear a mask to help prevent the spread of TB bacteria to others. Stay home. If you have TB disease, it is important to stay home and avoid contact with others until you are no longer contagious. This can help to prevent the spread of TB bacteria to others. Open windows. TB bacteria can survive in poorly ventilated areas. Opening windows and doors can help to improve air circulation and reduce the risk of TB transmission. Avoid close contact with people who have TB. If you know someone who has TB disease, avoid close contact with them until they are no longer contagious. Get tested for TB, if you have been in close contact with someone who has TB disease. Or if you have symptoms of TB infection, get tested for TB to help prevent the spread of the disease. Vaccine. Is there a vaccine to prevent tuberculosis? Yes, there is a vaccine to prevent tuberculosis, TB, called the Bacillus-Calmette-Guerin, BCG, vaccine. The BCG vaccine is made from a weakened strain of the bacteria that causes TB, and it is given to infants and children in countries with a high prevalence of TB. The vaccine can provide some protection against severe forms of TB, such as TB meningitis and disseminated TB, in young children. However, the BCG vaccine is not 100% effective in preventing TB, and it does not protect against pulmonary TB, which is the most common form of TB. In addition, the protection provided by the vaccine may decrease over time, so it is not recommended for use in adults. The BCG vaccine is not widely used in the United States, where TB is relatively rare, except in certain situations such as when an infant or child is at high risk for TB infection or disease. In general, the best way to prevent TB is to follow basic precautions to reduce the risk of infection, such as maintaining good hygiene, avoiding close contact with people who have TB, and getting tested for TB if you have symptoms or have been in close contact with someone who has TB. What is the outlook, prognosis, for someone with tuberculosis? The outlook, or prognosis, for someone with tuberculosis, TB, depends on several factors, including the type and severity of the TB infection, the person's overall health, and how quickly the infection is diagnosed and treated. With appropriate treatment, most people with TB can be cured and can return to their normal activities. However, TB can cause serious complications, especially if it is not treated or if the treatment is not completed as prescribed. These complications can include damage to the lungs or other organs, drug resistance, and the development of other health conditions, such as diabetes or HIV. In general, the earlier TB is diagnosed and treated, the better the outlook. It is important to complete the full course of treatment as prescribed, even if symptoms improve or go away before the treatment is finished. This helps to ensure that all of the bacteria are killed and helps prevent drug resistance. After completing treatment for TB, it is important to follow up with healthcare providers to ensure that TB has been fully cured and to monitor for any possible complications or recurrences of the infection. Regular follow-up can help ensure the best possible outcome for someone with TB.